Hello and welcome to this webinar. It's titled The Three-Step Plan to Avoid Diabetes Complications. And this is your pharmacist guide to protecting your feet, your eyes, and kidneys and taking back control of your health. My name is pharmacist Margaret Warner, and we are going to be exploring how you can avoid diabetes complications. Now, my journey with type 2 diabetes, I want you to imagine coming back home and not being able to recognize your mother, like the woman that gave birth to you, that you've lived with all your life. But because you went for your internship and you just came back for your leave, and then the person standing in front of you is a different person completely, right? This was what happened to me. My mother was experiencing frequent urination, unexplained, like unexplained weight loss. She had lost so much weight. She was she was weak. She couldn't even stand up to go to the bathroom to pee because she had been doing this over and over again. And her skin was very dry. Now, my mom was staying with my siblings. Yet my siblings did not understand what was going on, which is one of the reasons why I'm having this webinar, because I want everybody to have basic knowledge and understanding of what diabetes is so they can truly help people that need to be helped. Because you can't give what you don't have, you can't teach somebody what you don't know, which is why I believe everybody should understand what diabetes is. Now, how did we get here? So, my mom was very active in her business. She was always working, going out, like she would exercise in sort of, because she would trek a very far distance. And when she was very active in business, where she was also focused on eating healthy. You get, but then something happened. We told her to retire from active business, and that was the trigger. So because she retired from active business, she was at home 99% of the time and would only go out a few minutes per day or when she's going for a meeting. And this was what triggered it. First trigger is sedentary lifestyle, is a recipe for disaster. So if you know anyone who is not active physically and is just at home or in the office 90% of the time, that person will most likely come down with a chronic disease. So sedentary lifestyle is a trigger. Now the second trigger, my mom went for mugo, and because she was in a place where you have all this Milo, Bonvita, etc. For the mom that's newly delivered. So my mom started eating indiscriminately, and she was taking tea and bread every day, Coke, Pepsi. These are fizzy drinks common in Nigeria. She was just eating carb-rich foods even at night. This is another trigger. High processed foods do not give you any nutritional value. Rather, they set you up for chronic diseases, diabetes being one of them. The third trigger, my mom became overweight. Now, match these three. The first two is she was not exercising, she was eating indiscriminately unhealthy foods at night. What would you expect? Yes, she became overweight. Unhealthy eating and lack of physical activity would make you overweight, and being overweight or being obese is a major risk factor for type 2 diabetes. Now, perhaps you're here and you're asking this question: how do I manage diabetic medications? You already know my situation. I am on 100/2000 gavusmet, that is 100 milligram of vidaglutine and 2000 milligram of metformin, then 8 milligram of glimepiride a day with 400 milligram of all of these are medications for sugar control. And you're saying, how can I manage my diabetes without having to depend so much on these drugs? You're welcome to the right webinar. Now, Why is this topic important? It is very important because 1 in 3 people with diabetes will face complications. It's a known fact. Not because their drugs failed, but because education failed. I know someone that is close to me that was on his medication consistently, but still came out with a diabetic foot ulcer and had to get his leg amputated. And you would know why in the course of this webinar. So stay locked here. Make sure you watch to the end. Now, it's even scary because recent statistics show that in every 8 seconds, one person dies due to diabetes. So diabetes is not something you want to joke with, and I'm happy you stumbled on this webinar. I'm truly happy that you're watching it. Now, most complications are preventable with the right daily steps. But how do you know what to do if you don't have someone to guide you, or if you don't have access to the right knowledge that liberates? Why does this topic matter? Every 30 seconds, one leg is lost to diabetes. And in Nigeria, the chances of surviving after an amputation is usually low unless you have a very robust and dedicated family support system. So every 30 seconds, somewhere in the world, one person's leg is being amputated. Kidney disease is the leading cause of death in diabetes. If you go to the dialysis center and you see how painful the process is, if you see how expensive dialysis can be, and the prognosis, like the outcomes after several dialysis, especially when it is due to a chronic condition like diabetes, the outcomes are not usually very promising. So kidney disease is actually the leading cause of death in diabetes. 70% of patients were not taught how to prevent these complications. And trust me, diabetes complications are very preventable, especially if it is type 2 diabetes, which is the most common type of diabetes we have here in Nigeria. Diabetes isn't the problem. Trust me, diabetes is not the problem. Lack of accurate education is, because even scripture says that my people perish for lack of knowledge. So if you have the right knowledge, you'll be able to put your diabetes into remission. You'll be able to reverse this diabetes. What is diabetes reversal? It's a process, or it's a state where you get to where you no longer need to depend on medications in order to achieve normal blood sugar levels. So when you reverse diabetes, it means that insulin resistance is no longer playing in the picture. Your body can now on its own metabolize carbohydrates, but there is a process to getting to that stage, and which is ultimately what we want to show you today. My promise to you, at the end of this webinar, you will know what diabetes is, the complications that can happen to anyone with diabetes, and how you can prevent it from happening to you and your loved one. This is my promise to you. So if at the end of this webinar I don't fulfill this promise, I need you to call me out. Why people struggle with preventing the complications of diabetes? It is because they were not taught properly. That's one. And nurses don't have the time. Doctors are overwhelmed. If you go to the average hospital, a doctor sees over 200 patients per day. A doctor cannot take time to guide you, coach you, and hold you accountable over time, because it's really not feasible compared to the amount of money you're paying and the number of patients this doctor has to see in a day. The third thing is, you most often depend 80% of the time on drugs and insulin. Some persons even go as bad as depending 100% of the time on their drugs and insulin, and forget that it is these drugs do just 20% of the jobs. Yes, remember I gave an example of a man that was consistent on his medications but still went through the knife, right? Your drugs do 20% of the job. Another reason why you struggle with preventing the complications of type 2 diabetes is because you try YouTube, Google, and come up with confusing information. Today you're hearing that fats are good, tomorrow you're hearing that fats are not good. Next tomorrow, one Instagram vendor is selling purple flour, and like the informations are just everywhere, and you don't know what to do exactly. I was in that shoe, and I struggled for years to come up with a structure, a proven framework that can actually teach people what diabetes truly is and how they can reverse it, especially if they are from African descent. Yeah, because our meals are different from what the Western world consume. Now, real people, real result. This is one of my clients that referred me to someone. She said, I gave your number to someone in Abuja to join your class. That coaching is my saving grace. Anytime, any day, no matter the situation, I know what to do. This is the goal of the Diabetes Care Network, to empower you. So you're not depending on a particular supplement, a particular powder from Germany, from wherever that you cannot even access without that vendor. We want to empower you to know what to do, because if we don't do a good job, you would not refer us to others. 5 reasons people remain stuck. One, lack of structured education. I am a pharmacist today because I went through a structured curriculum that took me from a novice to understanding what drugs are. Like, even if you wake me from my sleep, I know the kind of drug to give for any disease condition. This happened because of intentional education, intentional mentorship. And this is my belief, that if people are trained or educated in a structured way, they would become masters of anything, especially diabetes, which is our focus. People also struggle because of lack of clarity on what to do daily. Most persons rely on guesswork management. So I have done the guesswork, so you no longer have to do it. Okay, so now we'll be giving you a proven framework that works. No daily accountability system, zero coaching, lack of a support community. Another result: 24th of September, I chatted you about my mom sugar level. It was 24.4. This is way above the normal range of 3.5 to 5.5 millimole per liter. Imagine having 24.4. I was so confused. This is even my colleague, she's a pharmacist. I didn't know what to do. You told me to calm down, that we will bring it down without insulin. I was wondering how that would be possible. In your words, we will bring it down with diet and drugs. Thanks for the close monitoring and your advice. I'm really grateful now. I'm really grateful. Now my mom's sugar level is controlled. Her fasting blood level is between 3.5 to 6.1 since the last 2 months. Thank you. I'm super grateful. You don't need insulin if you have type 2 diabetes and it's not an emergency. We'll show you how. And just so you know, here we use diet and drugs, but over time, as your sugar level gets to this normal range, of course you would need to reduce the medication dose, so much so that over time you'll not have need for the drugs. So why should you listen to me? The past 30 minutes I've been explaining diabetes, and I'm sure you already know that I know what I'm saying. Anyway, I am a pharmacist. My name is Margaret Wona. I have over 7 years of experience coaching, teaching, training diabetics, and showing them how to reverse the disease naturally without having to depend so much on drugs. As a pharmacist, I know that drugs are important, but I also know that drugs have side effects, and over time you don't want to depend mostly on the drug, especially for a chronic condition that can be properly reversed using lifestyle changes. In pharmacy school, we are trained that you only go to your drugs when you know that is the only thing that can work. Yeah, and you always want to use the minimum dose. So if your doctor keeps increasing the dose of your drug or the number of drugs you need, it means that something is wrong fundamentally, especially when it is a chronic condition like diabetes. Yeah, I'm the founder of the Diabetes Care Network, which is a safe space where we teach people how to take control of their health and beat diabetes. I help my mom and my clients reverse type 2 diabetes. I'm an award winning founder. I'm a Mandela Washington Fellow from the United States Government Exchange Program. I'm also the visionary of the School of Diabetes Mastery. Now, let's get right into it. What is diabetes? Diabetes is a chronic progressive disorder that affects how your body converts food to energy, resulting in high blood sugar levels. Okay, so it is progressive. Truthfully, diabetes is progressive. It gets worse over time if you don't do anything to halt that progression. It is chronic because you don't just wake up with type 2 diabetes. For type 1 diabetes, that can be acute because of the way it comes about. It's due to an autoimmune disorder. Once that disorder sets in, you can just wake up with high blood sugar level. Yeah. But for type 2 diabetes, before you're even diagnosed with type 2 diabetes, your body has been giving you signs for over 2 years and you did not pay attention to it. We're going to show you how to listen to your body subsequently. Yeah. So diabetes is what happens to your body that prevents it from being able to convert foods well, and then you start seeing high blood sugar levels. The hormone that is implicated in type 2 diabetes or in diabetes in general is insulin, because insulin is a very important hormone. Every hormone in your body is very important. Insulin is the hormone that is responsible for ensuring that your blood sugar level is within the normal range. Not just that, it also ensures that your body is able to store up excess sugar as fat. Now, the body functions in a state of balance. Balance is very critical in the body. The medical term is homeostasis, where we don't want anything to be too high and too low. So if you don't have insulin, the body will not be able to produce fats, and that is why people with type 1 diabetes are usually very skinny and often underweight, which is a medical condition. But when insulin is working optimally, the conversion of excess sugar to fat is going on well, and you put on a healthy weight. But when insulin is on overdrive, and you can trigger insulin to be on overdrive, your body increases the amount of triglycerides, cholesterol and fat that is produced. You become overweight. If you've been following this webinar, you would know that sedentary lifestyle, unhealthy meals will trigger insulin to go into overdrive mode. And once insulin goes into overdrive mode, you find out that you have increased fatty liver, you start putting on weight, and insulin resistance sets in because the body would trivialize what it sees often. So if insulin goes on overdrive for over 5 years, the body will get tired. It's called desensitization, and it will no longer respond to the action of insulin. Now, it is important to know that excess insulin is bad, low insulin is bad. We want insulin to be within the normal range. Insulin is released in response to food. So every time you eat indiscriminately, every time you eat food that have high, the word is insulinogenic effect, but it means a food that can easily trigger insulin, you would be causing your body to go into insulin overdrive, and you don't want that. I'm going to be very fast because I know I can teach diabetes in my sleep, but this webinar should not exceed 1 hour. So I'm going to be very fast, right? And just to let the cat out of the bag, if you want to understand diabetes in depthly, then you definitely need to watch to the end because I have a special offer for you. Now there are different types of diabetes. I know the major ones are just three, but when you come into the School of Diabetes Mastery, we would explain the other types of diabetes to you, and it is important that you get to know them. But for the purpose of this webinar, we'll be looking at the three common types, which is type 1, type 2, and gestational diabetes. Type 1 diabetes happens when the cells that produce insulin are destroyed, either through a virus, an autoimmune disease, or through genetics. And it happens majorly in children, and insulin is the mainstay of therapy. Type 1 diabetes cannot be reversed. Again, as a pharmacist, I'm going to tell you the truth. Type 1 diabetes cannot be reversed. It can be cured if there is a surgical transplantation of a working pancreas. Otherwise, you have to be on insulin. So that's for type 1 diabetes. For type 2 diabetes, which is the most common type, it can be reversed because we know that insulin overdrive is being triggered by sedentary lifestyle and the kind of foods we eat 80% of the time, and for 20% of the time it's their genetic predisposition. But again, your genetic predisposition does not tell you or induce you to keep eating. You have control over that one. That is why type 2 diabetes can easily be reversed. When you change your lifestyle, you start seeing positive results. Again, this one is majorly dependent on genetic factors, family history, and your lifestyle. Obesity and fatty liver will trigger type 2 diabetes when there's especially when there's a sugar overload. Again, certain diseases like hypothyroidism can trigger type 2 diabetes, and the use of certain drugs like some steroids. Those of you that take dexamethasone to put on weight, the Lord is with you. Another type of diabetes is gestational diabetes. It occurs due to pregnancy. So this one happens only in women because they get pregnant, and sometimes the pregnancy hormones prevent insulin from functioning properly, and they start seeing increase in their sugar level. The truth is, once you put to bed, the condition reverses because those pregnancy hormones that triggered, should I say, a resistance to insulin action in the body would have reduced after delivery. So it resolves after delivery. But in certain women, it can progress to type 2 diabetes. So it is very important that you catch it, or once you deliver, you become very intentional about your lifestyle choice. Again, it's important to say that healthy lifestyle choices should be everybody's business. You don't have to wait until you have a chronic condition before you start being intentional about your health, right? Preventive medicine is cheaper than curative medicine in every ramification, from financial cost to bodily implications. Preventive medicine is cheaper. Pregnant women again are advised to register for antenatal early enough and be regular at their clinics because gestational diabetes is a big deal and you need to treat it, like you need to monitor it consistently so that both mother and baby are safe. Now, what are the common signs of diabetes? Excessive hunger, excessive thirst, you are always going to urinate, you are not seeing very well, your hands and feet are numb, you cannot feel any pain, or you start feeling tingling sensations that are very painful, as if there's constant needle in your hands. Those are signs of diabetes, and diabetes that is not controlled. You start having erectile dysfunction, unexplained weight loss, non-healing wounds, muscle wasting, you start having skin folds or skin tags, or you start having this dark coloration around your neck, your armpits, and your groin. All of these are common signs and symptoms of diabetes. And when you come into the school of diabetes mastery, we'll take our time to explain everything to you. Now, here are some facts about diabetes that no one is telling you, and I hope you are able to settle it in your hearts here, that type 2 diabetes can be reversed and put into remission. It's a known fact, everybody knows it. Type 2 diabetes is said to be in remission when your blood sugar levels are normal at for at least 3 months without the use of medications. Again, fact number two, medication alone will not make your diabetes get better. I don't know how else to shout this. Medication alone will not make your diabetes get better. There's a drug now that is called the wonder drug for diabetes. It works by excreting, like making you urinate such that all the sugar in your blood is being passed out through your kidneys. It's a safe drug for now, but then it's going to mean that your kidneys are going to be overworked. The question I want to ask is, the previous drugs, where do they take the glucose to? If this golden drug is eliminating the glucose from the system. I don't want us to go into the technicalities of medications in diabetes use, but I want you to reason or understand that drugs alone will not make your diabetes get better. If your blood sugar level is high, there is a way to bring it down naturally. And you're the one that is responsible for your health. Even after watching this webinar, it is you that will make that decision that I want a change. I want to be free from diabetes. Lastly, there is no processed food that is diabetes compliant. Every processed food you find out there has preservatives and additive, unless otherwise stated, 90% of the time. And because they are highly and ultra processed, they release sugar into your bloodstream very fast compared to the natural foods that still have fiber that would slow the digestion or the release of glucose into your bloodstream. Now another set of results are from people like you. This one says that after carefully reading through the book, yeah, we have books that we also give out in our course. It gave me a general idea on how to manage the condition. I followed the directions on dieting, though it was not easy, but I discovered my blood sugar levels started dropping from 18 millimole per liter to 7 within a month, and in less than 2 months it's down to 4. Wow, without having to take so many drugs. This is my favorite client. She's even a pharmacist. She says that I got to know you through a link my friend shared concerning your online talk on diabetes. It was an interesting one, and I bought the book immediately you mentioned and used it to monitor my mom who is diabetic. Everything worked as I followed the details in the book. Her sugar level dropped from 200 plus, that is 200 milligram per DL, that's about 11 millimole per liter, to 90. 90 is about 5.5 millimole, which is within the normal range. That she has to skip her drugs. She is within the normal range now with your manual. Thanks a lot for your book. It is very useful. I am already recommending it. So this thing works. This thing works. I would not be here hosting this webinar if I did not know that it works. It works. Now, do you know your numbers? These are the numbers that you should aim to achieve if you have diabetes. So you want your sugar level, that is your fasting blood sugar level, which is the middle one, to be less than 100. That's 99 milligram per DL, and that would translate to about 5.5 millimole per liter, depending on the type of glucometer you're using. Don't worry, we will teach you this thing in details. Yeah. So if you are doing your A1C test, which is very important, A1C test is a test that shows you how well the body has metabolized or utilized glucose in the last 3 months. It's like your report card. That one, your A1C should be less than 5.7%. If it is within five, if it is greater than 5.7 but less than 6.4, you're pre-diabetic, and we have a special course for people within that pre-diabetes range. Then if your A1C is above 6, I've seen people's 6.5, I've seen people's A1C that is above 8, 10, 11. I'm like, hey, but they can bring it down in less than 2 months to the normal range. You just have to be responsible for your health. Now, complications of diabetes. Diabetes is that condition that can affect every organ in your body, from your eyes to your heart, to your nerves, to your legs, to your kidneys, to your brain, to your skin. Name it, diabetes can damage any and everything, which is why I have made it my life mission to teach people how to beat diabetes. I use that word beat because as a pharmacist working in the hospital, I've seen what type 2 diabetes have done to people in the medical world. Let's not even go into it. But diabetes is that disease that, when taken for granted, can just mess you up. You just wake up one morning, they've cut your legs. You just wake up one morning, you cannot see. So please listen to what I'm saying and sign up once I let you know about the offer. Okay. Now, the major complications of diabetes can be divided into two. We have the one that affects your small blood vessels. It is called microvascular complication. Then you have the ones that will affect the large blood vessels. That one is macrovascular complication. No one is better than the other. it's just the name because these organs are supplied, or these organs get blood from the small vessels. That's all. Whether it is microvascular or macrovascular, they are all deadly complications. We don't want any of them. So complications to the eyes, the kidneys, and to your neurons are within the microvascular complications. And if diabetes affects your eyes, you come down with diabetic retinopathy, which is leading cause of blindness. If it affects your kidneys, you might come down with chronic kidney disease. If it affects your nerves or your neurons, you have neuropathy. Once you have neuropathy, you start having these tingling, painful sensations in your hands and your feet. The doctors might give you drug to just give you a temporary relief, but it's a signal that things are going bad. And it can kill your nerves, so that if you have an injury, you will not feel the pain in your brain, because your nerves are what connects the body parts to the brain. And if that connection is tampered with, which is what high sugar level would do, you can have an injury to any part of your body and the brain would not know. But since if you have an injury on your hands, you can easily see it, but at your on your toe, you may not see it, because it's not every time you do foot examination, which is one of our major curriculum at the School of Diabetes Mastery. We teach you how to do your foot checks. So if you have an injury in your foot, like on your foot, and you would not know because it is not painful, the nerves they are dead, so the brain will never tell you that something is going on there. Before you know, bacteria would grow up, and that's how amputation starts. So diabetes can also affect your brain, can lead to coma. Diabetes can affect your heart. So if you have diabetes, your risk of coming down with hypertension is high, and vice versa. Now, what we have covered so far, we've talked about diabetes, the types, the signs and symptoms, how to know if you have diabetes. We've looked at the numbers and the complications of diabetes. So I'm keeping my promise to you. All right. Now, before we progress into the steps to avoiding the complications of diabetes, I want to give you this offer. You are not happy about your weight. There are two types of people I have been working with in the last 7 years. The first divide are people who are overweight. You know you're overweight or you're obese and your sugar level is very high, you're diabetic and you're trying to lose weight. If this sounds like you, then listen to me. The other divide is your weight is within the normal range. Your It almost feels as though you are becoming underweight. You keep on losing weight despite the and even though you're losing weight, your sugar level is still high. If you're in any part of this divide, listen to what I have to say. Okay. So if you look sick, you're not happy with your skin is flappy, it's dry, listen to me. If you have been diabetic for 0 to 15 years or more, listen to what I have to say. And if you're tired of taking multiple drugs, listen, as a pharmacist, sometimes when people come to the pharmacy and I see their prescription from the endocrinologist, I start counseling and they say, yes, the doctor said this, but they don't have that accountability partner, that well structured platform where they can learn. So it becomes very difficult for them to know that it is even possible to reverse the disease. There are lots and lots of medications. And again, if you depend on drugs, it's a common practice. We all know the drugs you used when you were 1 to 2 years into diabetes, not the same drugs you're taking now that you're 10 years into it. They've increased it. The question is why. So if you're tired of taking all these plenty drugs, cholesterol drugs, blood sugar drugs, if you're tired of taking them, if you're tired of taking insulin, and you're experiencing symptoms of high blood sugar that we discussed, if any of this sounds like you, then I want you to join the School of Diabetes Mastery. Listen, the name of this school is intentional. I want you to be the master of diabetes. Remember what my coaching client said, that after 2 years, I know exactly what to do. That is when you've attained mastery. This is not mastery of diabetes alone. This is mastery of yourself. I will explain about let's hold that thought. I will explain it further in the next few slides. Now, it's possible that you bought books, you've watched free training where a particular supplement or tea was sold. At the Diabetes Care Network, we don't sell teas or supplements. I teach that you can get these teas from your house. You don't need to buy special cinnamon tea from me. You can buy cinnamon tea in the market, in the supermarket. You don't need to depend on a particular supplement. You need to know how your body responds to the foods, the teas, the phytochemicals around you, so that you make an informed decision. So if Pharmacist is no longer around to supply that supplement or that international powder, are you going to die from type 2 diabetes? No, which is why we give you options. So I don't follow that school of thought where you have to be taking yellow pink swallow or a special type of food that you know that if that person dies it is over for you. I'm so sorry, but it's the truth. There's no difference between that product and your drugs, but there's a way you can master your body's rhythm, your system, your stress level, your relaxation technique. There's a way you can master all of this, and you will then use the simple 6 classes of foods we have in the house: protein, fat, carbohydrates, the ones that are available in the Nigerian markets, and use it as your weapon to reversing type 2 diabetes, which is one thing that stands us apart, that differentiates us from the crowd. You become the master of yourself and diabetes. You don't need to depend on any special product. We tell you why you should take this kind of food, and we even teach you how to know if that food is good for you. You become a master of diabetes, right? You might have even um taken those teas that works for a while and then they stopped working, or you try different programs yet your sugar level is still high and you're tired of the drugs and the cycle. I see you, I understand you. When my mom was diagnosed in 2019, I was confused. They will tell you eat potato, potato is good. You eat potato, the next day your sugar level is high. It's because okay, my background as a pharmacist helped. I could see that this thing they are saying is not accurate. We're going to teach you how to monitor. So you don't just take my words for it. So I had you in mind when I created the School of Diabetes Mastery. The School of Diabetes Mastery is not just a course, it's a school. It's a school because I'll be in your face. I'll be that teacher that is always there to tell you that have you watched this course? What is your review? And you have to submit your review, right? And we'll meet every week. It's both flexible and we also have a way of holding you accountable. So you can watch the videos. The videos are very short and they are not bulky, over a period of 4 weeks, and we'll give you those videos in bite sizes every week. Then we'd have our weekly review where you just talk about what is working and what is not working, your observation, and we can just put you through. So it's not just a course where we cramp you into a place and abandon you. I cannot do that. It is a school where we make sure that you understand what this disease is. And for the last few months in 2025 that we've been doing this, we are just test running it. The feedback, my God, the way they start in day one and what our clients become on day 30 are worlds apart. And that gives me joy, right? So it is a structured coaching, learning, and mentorship program that is designed to help you break free from type 2 diabetes for good. Now, I'm going to be coaching you. I'm not going to leave you in the hands of any contracted coach. No, I will be with you. I'll be holding you accountable. I'll be showing you the proven framework that has worked over the past 7 years. You will not just learn, we will make sure that you take action every single week for the next 4 weeks, and you will see that transformation will begin to happen. We have our own diabetes trigger assessment that will tell us where you are in your journey and your knowledge level in terms of reversing type 2 diabetes. And with that assessment, we would give you a personalized guide that is tailored for you. This is my promise to you. Now, this is not even everything you learned from the School of Diabetes Mastery, but it is a core part of the training curriculum. We'll look at the power of your subconscious mind, because it's one thing to register for a course, it's another thing to apply that knowledge. Knowledge is not powerful. It is only knowledge applied that has the power to transform your life. And the only way you can translate learned knowledge into practices that deliver the results you want to see is by leveraging the power of your subconscious mind. And I'm going to be teaching you that in the very first module. Because if your mind is not in the right headspace, everything I say would just fall on, it will be like water on stone. It's not going to get inside you, and if it does not get inside you, you will not be able to change or translate from knowledge to practice. It is in the practice that you see the results. So I'm going to be training you and teaching you how to tweak your subconscious mind so it delivers the results you want, which is low blood sugar level. Then we're looking at introduction to diabetes, like an in-depth introduction. What I just did in the last 20 minutes was just to brush. So look at in-depth introduction into the types, the signs, the symptoms, why they happen, and the complications. We'll look at how to prevent the complications too. We'll also talk about the 5 diabetes myths that are killing you. We'll look at explaining how you got type 2 diabetes. We'll also show you how to eat to reverse type 2 diabetes. I will show you the top 10 foods that would worsen your diabetes, the top 10 foods that will reverse your diabetes. We'll look at detoxification for diabetes reversal, diabetes and your sexual health. Yes, there will be a special module that explains diabetes and your sexual health, how to reverse diabetes when you're losing weight, the right approach to your diabetes medication when you're on this program, right? And how every other person should view their diabetes medication. We'll have a special video for that. We'll be exposing you to green juicing and how it helps with diabetes reversal. We'll show you how to take care of your teeth and your foot. These two organs are usually ignored, but they play a significant role in how well you're able to control or reverse your diabetes. We'll look at how to activate your rest and digest system for better blood sugar control. We'll be looking at the place of supplements in diabetes reversal. Is it all supplements that you can take? The answer is no. So how do you know the ones that are good for you? And our video on detoxification is an award-winning video. It is detailed. We'll also look at understanding down phenomenon, why your sugar level is very high in the morning even after you did not eat during the night. We'll explain it and how to win it. We'll talk about the right exercise for diabetes reversal. See, this School of Diabetes Mastery is loaded. Trust me. It is everything you need, and you have lifetime access to the videos, and we have a supportive alumni community. For 90,000 naira only, this is a steal. So immediately, if this feels like something you should do in this 2026, send us a message on WhatsApp to 9900 09013611713. Again, it is 09013611713. If you're outside Nigeria, then you add the code +234 9013611713. Send us a message on WhatsApp and we will enroll you into the School of Diabetes Mastery. Now, let's continue. The 3-step plan you can take that would help you avoid the complications of diabetes. Number 1, eat to heal. Number 2, fast to live. Number 3, exercise as a way of life. So even if you don't register for the School of Diabetes Mastery now, I'm sure by just interacting with this webinar, you've been able to gain knowledge on what to do. So in the next few slides, I'm going to be giving you practical steps that would help you avoid the complications of diabetes. So step one, eat to heal. Food is not just energy. You don't just eat to get energy. It is an instruction to your body. When you eat, you're either healing your body or you're harming your body. Food is medicine. It can also be a poison. So with this understanding, the next time you want to eat something, you would ask yourself, is this food actually healing me or is it killing me? That's number one. Most people eat to just fill their stomach. That should not be you. People who thrive and reverse diabetes learn to eat with intention, because your food can either be a medicine or a poison depending on how you use it. We're not going to tell you to starve. No. There's a place for intermittent fasting, but the period when you eat to nourish your body, eat to heal. When you're eating, tell yourself that I'm eating to heal. So it will inform the kind of food you eat. Every time you eat, again, you're either choosing to heal your body or harm your body. That's the first step. Now, what again? I will not just tell this is the first step, but I will tell you the how into the finest details. You've heard that carbohydrates are are poisonous. No, you need carbs. You need carbs. Carbohydrate is not your problem. It's the type of carbohydrates you're eating that is the problem, and how you're eating it. Complex carbs are better than processed carbs, right? So you need your carbs, but there's a way to get those carbs. Now, you want to eat foods with low glycemic indices. That you want to eat carbs that have low glycemic index, yeah, and you pair them with your vegetable sauce. This is the secret ingredient. Your vegetable sauce should contain ugu, scent leaf, fresh tomatoes, dry fish, lots of crayfish, and should always be in your refrigerator. So when you bring out, say, two slices of yam, as I'll be showing you in the plate method, you want to fill the other parts, like 50% of your plate, with this nutritious, dense vegetable sauce. And I'll show you how to go about eating it. So when you pair your sauce with yam, your local rice, or your father rice, or any, for me, I favor the local rice or the father rice. There's a difference between sweet potato and irish potato. We teach all of this in the school of diabetes mastery. So when you hear potatoes are good, it's not all kinds of potatoes that are good. But when you add this your carbs to your plate, you'd also need to add your vegetables. So let me show you how to do it. So your carbs should take 25% of your plate. That's one fourth of your plate. Then your proteins should take the remaining 25, and your non-starchy vegetables. Carrot is a starchy vegetable, so you don't want to fill your plate with a starchy vegetable. You fill it with non-starchy vegetable. That's leafy vegetables. Should take 50% of your plate. And when you want to eat, you start with your vegetables, go to your proteins before you eat your carbs. By the time you eat this way, you'll be full and satisfied. You drink at least 2 glasses of water. You would have nourished your body. You would not feel too tired. And again, after eating, it's important to just take 2 hours walk, or take, depending on the kind of job you do and the amount of time you have. After eating, try to take a walk. Try to take a walk. It helps keep you alert. The second step is fast to live. Number one, step one, eat to heal. Step two, fast to live. Intermittent fasting helps insulin work better. Remember when we started, I said that whenever you eat, insulin is released, and you don't want to put insulin on overdrive. So you want insulin to work better, you need to fast intermittently. What is fasting? Fasting is simply the period of time when you're not eating. Fasting gives your organs rest. It prevents an overload on your pancreas and your liver. When you fast in the morning and you have evening breaks from food, it helps stabilize your sugar level. So how do you fast? You start small, from 12 hours to 14 hours to 16 hours. We have a full module on intermittent fasting. But something I can leave with you real quick that will deliver results to you is that when you have your last meal of the day by 6 p.m., Your last meal, you tell yourself this is the last meal I'm having. My dinner is by 6 p.m. And if you don't eat till 6 to 7 a.m. the next day, you don't even take snacks, because even if you want to do healthy snacks like your almond, your nuts have some form of carbs in it. Okay, so it will even defeat the process. So if your last meal is by 6 p.m. and your first meal is at 8 6 a.m., you'd have fasted for 12 hours. This is how easy it is to fast. Then if you extend your first meal to say 10 a.m., you'd have fasted for at least 14 hours. So intermittent fasting is not something very technical. It's something you just have to be very intentional about. Now, best drinks during your fast: water, your green juices. Who must not fast without supervision? If you're pregnant, please, you don't have any business fasting. If you have diabetes and you're pregnant, work with your doctor. He may likely give you insulin, which will be safer because it will not cross the barrier to affect your baby. So follow that regimen until you deliver. Once you deliver, two things will happen. Either the diabetes will reverse on its own, or you might still have glucose intolerance, and we can then work with you to reverse it completely. But when you're pregnant, it is very critical. We don't want you to be fasting when you're pregnant, right? Then, if you have kidney issues, you want to talk to your doctor before you start any kind of fast. And if you're on medication, that's why you need a health professional to guide you so that we can adjust your medication. And we can also work with your endocrinologist. As your sugar levels get better, your medication dose will be adjusted. Step three is exercise as a way of life. Movement is not an option for anybody. I don't think there's any animal God created in the world that stays one place. They are always moving. So movement is not an option. Exercise is therapeutic. And again, don't think that because you're having stressful choice, you're cooking for 1 hour, because you're going through stress does not mean you're exercising. No. The hormones released during stress is different from the hormones released during exercise. If you want to know more, register for a School of Diabetes Mastery. Exercise is one of the fastest ways to lower your blood sugar level without drugs, but people see it as punishment instead of healing. That's why we need to transform your subconscious mind. Now, when you exercise, you build muscles. When you build muscles, your muscles will soak up excess glucose, even without having to need insulin. Sitting for 5 hours would increase your sugar level, so you need to exercise, you need to move. You don't necessarily need the gym. By just walking or taking the stairs instead of using the elevator, it all counts. 10 minutes see 10 minutes after meals will help reduce glucose spike by over 30 to 40%. Imagine walking for 30 minutes after meals. Exercise will improve your mood. Again, the hormones released during stress are not happy hormones, but the hormones released during exercise are happy hormones. We'll explain that later. Now, again, are you very serious about beating and reversing type 2 diabetes for real, especially in this time and season? Are you experiencing one or more of the complications of diabetes? Maybe you're starting to see blurry vision and your doctor is telling you to be very intentional about your lifestyle, or you're starting to experience wounds that don't heal, or maybe you're just watching this because of your mom or your dad, or maybe you're type 2 diabetic on multiple medications, or you don't want to wait to lose your leg, go blind before taking action, because like I said, preventive medicine is cheaper than curative medicine. This is why I want you to join the School of Diabetes Mastery. You will learn how to reverse type 2 diabetes naturally and sustainably, even if it runs in your family and even if you've had it for 10 to 15 years. You will discover your stress triggers and that your stress triggers that increase your sugar level, and will show you how to eliminate them. You will learn how to eat to beat diabetes using our meal plan. You see this meal plan, you see those books those people were talking about in the testimonials. It's the meal plan and our other book. I will give it to you free of charge. And this meal plan is a game changer because you get to enjoy your Nigerian food without fear. and it will still not spike your sugar level because we'll show you how to do it. We also help you reduce your medication dose, which is something we call medication de-escalation process. As your diabetes gets better, we can even work with your endocrinologist to get this done if that will make you more comfortable. Okay, then we'll also give you our special intermittent fasting blueprint. Now, these are some of the things that our previous participants are saying. Now, I asked a question. Um, if yes, please write a short testimonial in your own words. And it says, registering for the School of Diabetes Mastery is the best thing that happened to me in 2025. I discovered the secrets to managing and reversing diabetes and why my family would not fall into this trap. Like, this is generational blessing. I'm happy. He even went on to say, God bless you guys. I'm happier and fitter. My eye is on the goal of keeping my sugar reading below 100 millimole per liter. That is the spirit. Like, the transformation you get in the School of Diabetes Mastery, you will not get it anywhere. Because you will not get a more committed teacher, a more committed pharmacist, a more licensed pharmacist that would be teaching you how to reverse type 2 diabetes, not just from my experience, but from my training. I have a certification as a diabetes educator from the International Diabetes Federation. I don't want to go into all of that, but I need you to be assured that you're coming to meet a professional. Now, we said on a scale of 1 to 10, how would you rate your overall experience with the School of Diabetes Mastery? He gave us a 10. 10 over 10. Clock it. Now, even in the School of Diabetes Mastery, you would learn over 10 healthy teas recipes. So nobody will tell you that this is the only tea to take. No, we'll show you how to prepare it at home. Your unique diabetes assessments too. We have weekly life coaching calls. Yes, I am that committed to help you get the answers to your specific struggles directly from me, your diabetes mastery coach. You have an active WhatsApp accountability group, so you never get to feel alone. We will move together. You also be moving together with others on the same journey. And when you're done with the 1 month training, you would be added to our alumni community. So you're not alone. Again, more testimonials. We asked, have you seen any improvement in your blood sugar levels, medication use, energy, or weight since starting the program? And he said, in 1 month, I lost 6 kg. My fasting blood sugar dropped from 412 to 139. I recorded a random sugar of 99. When you start this process, the first change that you see will be your random blood sugar, because after eating, your body reverses, or your body utilizes sugar better, because once you start, insulin improvements is almost immediately. But your fasting blood sugar may not be exactly will not come very low because of that phenomenon. We will explain all of these things so you're not confused or discouraged. Now, you might be saying, I don't have 90,000 naira to pay. Hey God, how much is 1 month supply of medication? How much is 1 month supply of medication? How much is it? A pack of linaglutine that has just 30 tablets is over 164,000 if you're buying the branded one, which is Tragenta, or if you want to buy the unbranded one, it's around that 30 to 40,000 naira range for 1 month, and it is not a guarantee. So let's look at the real cost of diabetes. Medication cost only for a period of 5 years. Oral drugs for 1 month, you will spend over 60,000 to 300 per year. This number is not even accurate. I think this is from last year. Okay, let's say everything is very cheap. You're buying the cheap ones. So in a year, you're spending on drug. Your spend on drugs is within 60,000 to 200,000 naira per year. So it means that in 5 years, you'll be spending over 300,000 to 1.5 million naira. We know that this number is very, very humble. It's very, very, like, this is the least you can get. If you're on insulin, in a year, you should be spending around 240,000 to 600,000 per year. and in 5 years you should be spending about 1.2 million to 3 million. Let's look at the complications that can happen within 5 years if the disease is not reversed. Kidney dialysis, you spend at least 3.5 million to 7 million per year, and in 5 years you can be spending over 35 million naira depending. Amputation surgery and rehab is not cheap, and you would have lost your leg. Heart attack or stroke treatment, eye surgery. So how much is all of this compared to 90,000 naira that would give you life access to the teachings that you need to reverse type 2 diabetes from the comfort of your home? Bonuses: once you register for the School of Diabetes Mastery, we are going to give you a blood sugar mastery tracker. So you are not doing any harsh things here. We'll give you the document that you need that would support your journey, right? And we have a 1 month meal plan so that you're no longer confused about what to eat and when to eat. Would also give you a book, Managing Type 2 Diabetes with Ease. So this is the second book. When you combine this book, Managing Type 2 Diabetes with Ease, with the meal plan, it is over. Now, imagine the other goodies, the videos, the training, the accountability, the coach, the reviews that will come alongside all of this. There is no way you will go through the School of Diabetes Mastery that you will not get the answers you need. Listen, 90,000 naira is even a steal. If you think I'm lying, go and check others. 90,000 is even, but I'm not here because of others. I know why I'm here, because the experience I had when my mom was diabetic, I don't want anybody to go through it. I do not want anybody to go through it. You also get 21 most asked questions about diabetes answered. So again, if you're ready, I recommend that you make that transfer and send us a message on WhatsApp to get the transfer details. Or you can look at the link in the description of these videos. But if you cannot find the link, which is not going to be, if the link is attached to this video, but if you want to send us a message, do it to send us a message on WhatsApp, and we'll be able to guide you on how to make payments and onboard you into the school. Again, the School of Diabetes Mastery is a step-by-step online school that would help you reverse type 2 diabetes. It is practical, it is intense, but it is achievable. Like, it gives you that result. It is result oriented. Okay, and it is flexible. You can watch the videos at home, or when you're exercising, when you're in the gym, you can listen to the videos. You can listen to me teach, and you get the gist that you need. And then we can ask questions on the group, and you get the support that you need. Then during the weekly reviews, you can also ask, and would ask, like, it's a structured school where we would get your sugar level readings for the week, and will ask and assess, and together you'll be able to know what you did that triggered the spike. Okay, so these are everything you'll be learning. Please, if you have any iota of conviction that you should make this commitment to your health, that is all you need. Send us a message on WhatsApp, or click the link in the description of this video to register for the School of Diabetes Mastery. Ready to take control? I hope your answer is yes. The future is not an accident, it is a decision. So imagine the future, like imagine who you would become when you go through the School of Diabetes Mastery, the freedom you will get from taking multiple medications, the knowledge you will get after going through this course. Imagine it. Make the right decision and click the link to register. Thank you so much, and I hope to welcome you into the community.